Hello students. So today we'll learn how to interpret an shoulder x-ray for a patient with hemiplegia. So specifically how to spot an inferior shoulder subluxation, which is very common in this kind of cases. So first let us understand what is inferior shoulder subluxation. So inferior shoulder subluxation means the humeral head, that's the ball part of your ball and socket joint, has dropped downward from the socket, that is your glenoid cavity. So why these things happens? So this happens because the shoulder muscles, specifically your rotator cuff and deltoid muscles, become weak and flaccid due to the paralysis. Now gravity pulls the arm down and the muscle cannot hold it in proper position or proper place. Now let us understand what X-ray do we look at for this kind of circumstances. So we use a standard AP, that is your anterior posterior view of shoulder. This view shows us the position of the humeral head, the glenoid cavity, the clavicle, the acromion and surrounding bones. Now what is normal alignment in an X-ray, shoulder X-ray? So in a normal shoulder X-ray, the center of the humeral head is aligned with the center of the glenoid cavity. The humeral head sits like a golf ball on a tee, snug and round inside the socket. The distance between the top of the humeral head and the acromion, called the Acromiohumeral Distance, is about 7 to 14 mm. Now next question is, how does subluxation looks in an X-ray? So in a hemiplegic shoulder with subluxation, the humeral head drops downward. So you will see a bigger gap above it. The humeral head looks like it's hanging below the socket instead of sitting inside it, that is your inside the glenoid cavity. The acromiohumeral distance increases. If it's more than 14 mm, we suspect subluxation. There may be a visible gap between the glenoid cavity and the humeral head. Now, how to check these things on X-ray, we'll see step by step. So step number 1, you need to find the glenoid cavity. So it's the shallow socket on the scapula. Next, you need to look at the humeral head. It's a round, smooth ball on the top of the humerus. So now your glenoid cavity you have marked your head of the humerus. Now you need to draw an imaginary line through the center of the glenoid and the humeral head. So it should be aligned vertically. That line should be aligned vertically. Next, the acromiohumeral distance you need to find out. So it is the gap between the topmost border of the acromion and top of the humeral head. So if the gap is bigger than normal or the humeral head sits below the socket, then inferior subluxation is confirmed. Now you need to always correlate these findings clinically, that means with the patient's signs and symptoms. First, you feel for a gap below the acromion called the Sulcus sign. If you can fit 2 or more fingers between the acromion and the head of the humerus, then it is likely a inferior subluxation. So patient may have associated pain, shoulder droop and difficulty moving the arm. Now let's understand few points regarding the management, how to manage this kind of cases. Always remember, position is the main key. You need to support the arm. So you can either use a sling or you can use taping to reduce the downward pull due to the effect of gravity. You can start with gentle passive or active assisted exercises to maintain the mobility of the shoulder joint. 10. Strengthen any active shoulder muscle if possible. You can even use functional electrical stimulation if indicated. So this is all about today's topic of discussion. So in case you have any kind of doubt or any kind of clarification you want, so you can always comment in our comment sections, and you are most welcome for any kind of doubt clearance. Thank you very much.